Hello, my name is Yerix and welcome to my channel. This is my class presentation on panic disorder. The six categories I'll be talking about are the introduction, what is panic disorder, the etiology, cause and symptoms, the points in time in history, what happens to the brain in biology, and case vignette on Ryan Reynolds. The introduction, what is panic disorder? Panic disorder is a type of anxiety disorder. It can be unexpected and reoccurring, meaning that panic attacks can happen in an instant and the attacks can happen multiple times. These attacks can last for a few minutes, typically reaching its peak within 10 minutes. These attacks can be triggered. These triggers can include stressful life events, childhood experiences, trauma, abuse, social anxiety, a fear of social interactions or judgment from others, avoidance behavior to avoid places, people, or situations that you think may start another attack. Overactive imagination, basically, you imagine the worst case scenario, which heightens your anxiety to cause a panic attack. And negative self talk. The most common trigger to panic attack is negative self talk because it reinforces fear and a feeling of helplessness. The etiology, the cause, causes, or causations of a disease. Causes of panic disorder. Experts do not know the exact cause of panic disorder. It is thought to be linked to a combination of factors. Genetic factors to panic disorder can run in families. Up to 40% of relatives have a panic disorder, which can be passed down through generations. Biological factors in brain functions or abnormalities in the brain. This states that imbalance in neurochemical like pathways in the brain can regulate mood and anxiety, which then contributes to the development of the disorder. Environmental factors such as childhood trauma, isolation, stress, and pressure. Medical conditions like asthma, heart disease, respiratory issues, and conditions like depression and substance use disorder can cause panic attacks. Abbreviations to the symptoms of panic disorder. The abbreviation of the symptoms like sweating, trembling, unsteadiness, depersonalization, derealization, excessive heart rate, nausea, tingling, and shortness of breath. They would feel fear of dying, losing control, or passing out. They would also feel chest pain, chills, and choking. I would recommend to watch JJ Medicine or Psych2Go or TED-Ed as they would talk more about these symptoms in more detail. Anxiety versus panic attacks. The difference between anxiety and panic attack is that anxiety on the left has a chance to build up before reaching to a breaking point, which means that individuals can breathe and calm themselves before the breaking point hits and can cause a attack. Unlike anxiety attacks that can build up, panic attacks are unexpected and instant, meaning that you wouldn't realize it unless it hits. Panic disorder happens when you have repeated panic attacks. Just note that not everyone who experiences a panic attack develops a panic disorder. Diagnosis and tests. How is panic disorder diagnosed? According to Diagnostic and Statistical Manual of Mental Disorders, DSM-5 panic disorder is when you have repeated unexpected panic attacks and 1 month or more of worrying persistently about having more panic attacks or feeling the fear of dying or passing out, and or changing your life to avoid situations or places that you think may trigger another attack. History, origin of name and a history lesson. The history of the name panic disorder. Panic was from the word panikos, which was derived from the Greek mythology god named Pan, who is a satyr-like deity who was said to have an ability to instill sudden fear into people. The term panic came to be in the early 17th century and anxiety neurosis in the 19th century. In the ancient times, Hippocrates was often referred to as the father of medicine, who documented the conditions resembling anxiety and panic in his writings. During the Middle Ages, the mental health issues like anxiety were misinformed with a connection to supernatural causes like demonic possession. Before 1850, the symptoms for anxiety were then associated to signs and symptoms of depression. The reason why in the 1850 they associated anxiety to signs of depression is because their mental health understanding at the time were still being developed, which resulted to misclassification of panic symptoms to depression. In 1879, Henry Maudsley, English psychiatrist, used the term panic in its technical sense when describing melancholic panic. Melancholic panic refers to a state where feelings of deep sadness or melancholia are accompanied by panic or anxiety symptoms. Sigmund Freud contributed to the understanding of anxiety in the late 19th and early 20th century. He proposed that anxiety could arise from repressed emotions and unresolved conflicts. In the modern era, the name panic disorder was then officially recognized in the DSM-3 in 1980. The history of Plato and philosophy as therapy. In ancient Greece, Plato, the philosopher, was the first to describe emotions and states of being that are now linked with anxiety and panic. In The Republic, a book written by Plato, he discussed the nature of courage. He suggests that true courage involves knowing and understanding rather than mere emotional reaction. What he means by true courage from a philosophical standpoint, it involves acting in line with your moral principles, like doing the right thing despite the fear and adversity. He believed that philosophy could serve as a therapy for the soul. Individuals could gain insight to their emotions and fear, leading to a more balanced and rational life. The biology. What is a PET scan? A PET scan stands for positron emission tomography. The primary use for this scan is to observe metabolic processes in the body, often used to detect cancer, brain disorders, or heart conditions. The reason why PET scans are not often used is because a radioactive substance is injected into the body. The places in the body with the most metabolic activity would absorb that substance and appear brighter on the scan. The color scale is used to indicate levels of activity within the brain. We will now be looking at a normal control brain and a brain with a disorder. As we can see on the left, the normal control has normal readings on the PET scan, a high metabolism on the frontal temporal and occipital lobes. The frontal lobe is crucial for various cognitive and emotional functions. Temporal lobe relates to your memory, auditory processing, and emotional responses. Occipital lobe is known for its role for visual processing. Low metabolism in the brain can be caused by increased anxiety and stress. Bright colors like red and yellow indicates high metabolic activity. Darker colors like green and blue indicates low activity in the brain. Who are mostly at risk in developing panic disorder? Panic disorder is a common mental health problem. It often starts in the late teens or early adulthood. Women are 2 times likely than men to have it. People who have had trauma in their childhood are more likely to develop panic disorder as they grow. My case vignette on Ryan Reynolds. Ryan Reynolds grew up in a working class family in Vancouver. He struggles with anxiety and symptoms that are like panic disorder during his childhood. He describes himself as a really nervous kid because of his childhood experiences. He describes his interactions with his father as a skin-covered landmine, which indicates his father's stressful and unpredictable nature. Reynolds and his anxiety has continued to affect his teenage years. He continues to have anxiety and starts to have social anxiety at school. He developed a way for acting, which was a way to express himself as a defense mechanism and cope with his anxiety. During his teenage years, he shaped his resilience and found his way to understand mental health. His treatment and strategies. Reynolds shared his experience in anxiety in an interview and how he had struggled throughout his life. He practices mindfulness, meditation, physical exercise, and structured scheduling to maintain balance and reduce stress. Panic attack treatments. According to the Cleveland Clinic, these treatment options can help. Number 1, psychotherapy or talk therapy. is a term for a variety of treatment techniques that aim to help a person identify and change unhealthy emotions, thoughts, and behaviors. CBT, Cognitive Behavioral Therapy. One of many types of therapy, the individuals discuss their thoughts and emotions with a mental health professional like a psychologist and to learn coping strategies. Exposure therapy. This involves exposing the person gradually and repeatedly. Over time, the individual learns to become comfortable with the situation instead of it causing anxiety and panic. Number 2, medications such as antidepressants and anti-anxiety can help treat panic attacks or panic disorder. Lifestyle changes like regular exercise to reduce anxiety, healthy diet to minimize anxiety symptoms, sleep hygiene to improve mental health, and meditation to relax the muscles. Lastly, support groups. Joining a peer support to provide understanding and share experiences and coping strategies can be beneficial. I hope you have found this video helpful. Again, my name is Yerix. Thank you for watching.